right. Which of the following intervention is most appropriate for this patient? 60-year-old man presents the ED of fatigue, pallor, dark urine. Okay, reports recent flu-like symptoms. Temp is afebrile, pulse is 100 minute, respirations are 20, BP is normal here. Physical examination reveals pallor and icteric or icteric scleral icterus. I don't know why it's phrased like that. Laboratory findings show hemoglobin level of 7. Reticulate site count is high at 7%. Positive direct anti-globulin test with anti-IgM, anti-C3. I'm thinking like cold agglutinins here. Peripheral blood smear shows spherocytes. Okay. What does he have? Okay, anti-IgM, anti-C3. I'm pallor dark urine. So he has like a definitely like an anemia here. Um, anti-IgM, anti-C3. I want to say it's like that's like a cold agglutinins, maybe. Um, high reticulocyte count. Hmm. Something is telling me like it's in like the C or the AML or CML or CLL world, something like that. Um, but I don't, or it could be like a good pastures thing. I'm trying to think of what those are, if I remember what those are correctly. And then spherocytes. So I'm pretty sure spherocytes are the shearing. So something's being sheared. Um, iron supplementation, blood transfusion,
I'm gonna give
IVIG,
you a hint.
corticosteroid.
So,
Sure.
so shearing is usually schistocytes.
Schistocytes. Okay, so
Yeah,
spherocytes are
spherocytes are the red blood cells are completely spherical and not, biconcave,
okay. So no. Okay, so they're like they're okay. Isn't that usually something that is like the acrine proteins or something that's like in those RBCs that I'm thinking about? Okay. Hmm. I don't know where I'd get this patient here. Hmm. Iron supplementation is just like a iron deficiency, anemia. I don't really see that with the flu-like symptoms. Rituximab is really for like when I see rituximab, I'm thinking like Hodgkin's or something that's B cell related.
Okay.
Blood transfusion isn't a bad choice here because his hemoglobin level, although no, it's 7. So seven's the cut, I learned. So 7 is the cut. So it's probably like they would only want it if it's below 7. Corticosteroids. Not sure. Never like a bad choice. Flu like symptoms, fatigue, IVIG. Something's going on, especially if he has anti-IgM. There's a lot of IgM usually going on. Maybe this is more of like a chronic issue, and you're gonna want to give IgIM. So that's why I'm not sure what is most appropriate, like next for this patient. Um, I mean, yeah, I would say the first three are decent choices.
Okay.
I just don't know if you're gonna give this patient a blood transfusion, even though he has a lot of hemolysis going on. Um, I don't think I don't know why I'd give him steroids. Besides that, he's like not feeling well, fatigued, flu-like symptoms. But the rest of it, I'm not sure if that fits. Um, hmm.
What does your gut say here?
My gut says IVIG, but I don't really have a good reason. I would
Okay.
like to transfusion, but I don't think the numbers are appropriate.
Okay. Let's go with your gut and see what happens.
Okay.
All right.
I was
Let's kind
4%.
of see kind of what they kind of are saying here. So they're saying, fatigue, pallor, flu-like symptoms, positive this, spherocytes, consistent with autoimmune hemolytic anemia,
Okay.
especially warm.
Oh,
Um,
warm instead of cold. I was thinking cold. Okay.
yeah, it should be IgG. I don't know, but cold or warm, right?
Yep.
They're saying first for, autoimmune hemolytic anemia is actually cortisol, which helps
Okay. Makes
suppress
sense.
the immune response and decrease hemolysis.
Makes
Um,
sense.
IVIG, some cases of colon gluten, but it's not first line for warm. So I don't know if I
Okay.
truly like this question a lot because I guess because in my mind I remember IgG is usually warm and IgM is usually cold. So this is questionable, right?
Okay.
Blood transfusion, usually under 7, right? Like you
Right?
said.
Isn't that the rule where it's like seven's the rule? Or
Yeah, some people use 6.5, but usually under 7 is good. Under 7,
okay. Okay.
you can transfuse, and it's usually for one pack is equal to
Point?
one hemoglobin usually.
Okay. Okay.
Um, Rituximab, CD20,
Hmm.
which is found on B cells, right? Like you
Yeah, I was
said,
thinking more
right?
like, yeah, Hodgkin stuff, B cell stuff like that.
Yeah. And then iron supplementation, right? Not really appropriate, not going to really help too much here.
Okay.
Um, but let's look here. I can't remember. Let's see, IgG or IgM for cold agglutinin. Yeah, it's usually IgM is cold. Um, that's what I remember. So it's kind of weird that they call this
Okay.
warm. So I'm gonna probably throw this question out because I don't really like it. It's kind of
Okay.
confusing. So let me write that down real quick. Give me 1 second.
But for like, let's say it was just like autoimmune, it was like more vague, an autoimmune uh, anemia like this hemolytic anemia, then steroids, I guess, are the best choice. So it's like, okay, if I
Yeah,
just
yeah,
do a more bigger picture, it's going to be
yeah.
steroids. Okay.
Perfect.